Welcome to our comprehensive guide on drug rehabilitation centers. Look, addiction is a serious issue, and it's nothing to be ashamed of. It's a disease, and like any disease, it requires treatment. Today, we're going to pull back the curtain and take a look inside a drug rehab center. We'll explore the key components that make these centers effective in helping individuals overcome addiction and rebuild their lives. This isn't about judgment. It's about understanding and getting folks the help they need. All right, first things first, when someone enters a rehab center, they don't just get thrown into the mix. It's a carefully structured process designed to ensure the best possible outcome for each individual. The first step is a comprehensive assessment and evaluation. This initial phase is crucial because it sets the stage for everything that follows. This is where the professionals figure out what they're dealing with. They gather detailed information about the person's history, substance use, and any previous treatment attempts. They'll assess the severity of the addiction, the individual's overall health, both physical and mental, and whether there are any underlying issues like trauma or mental health disorders. This thorough evaluation helps in identifying any co-occurring conditions that need to be addressed. This isn't a one-size-fits-all situation. Every individual is different, and their treatment plan needs to reflect that. The assessment helps in tailoring a personalized treatment plan that caters to the unique needs of the individual. Think of it like building a house. You've got to have a solid foundation before you start putting up walls. Without a strong foundation, the entire structure is at risk. This assessment is the foundation of the entire treatment plan. It guides the professionals in creating a roadmap for recovery, ensuring that every aspect of the individual's health and well-being is considered. This way, the treatment is not just about addressing the addiction, but also about fostering overall wellness and long-term recovery. Now, detox. This is often the first hurdle in the recovery process, and let me tell you, it can be a bumpy ride. Detoxification is the process of clearing the body of drugs or alcohol, and it's not just about stopping use, it's about managing the physical and emotional symptoms that come with withdrawal. Detox is all about getting the drugs out of the system and managing the withdrawal symptoms that come with it. These symptoms can range from mild to severe, depending on the substance and the duration of the use. It's a critical step that sets the foundation for the rest of the recovery journey. For some substances, like alcohol, opioids, or benzos, detox can be downright dangerous if it's not done under medical supervision. The body can react in unpredictable ways, and complications can arise that require immediate medical attention. This is why professional oversight is so important. That's why it's crucial that this process happens in a safe and controlled environment, with medical professionals on hand to manage any complications and make sure the individual is as comfortable as possible. They can provide medications to ease withdrawal symptoms, monitor vital signs, and offer emotional support. Remember, withdrawal can be a real bear, but it's a necessary step on the road to recovery. It's the body's way of healing and adjusting to life without the substance. With the right support and care, individuals can get through this challenging phase and move forward with their recovery journey. Okay, let's talk about therapy and counseling. This is where the real work begins, the nitty-gritty of getting to the root of the addiction. See, addiction isn't just a physical dependence, it's a psychological one too. There are often deep-seated reasons why someone turns to drugs or alcohol in the first place. Therapy helps individuals understand those reasons, address those underlying issues, and develop healthier coping mechanisms. There are different types of therapy used in rehab, like individual therapy, group therapy, family therapy, you name it. Each one plays a crucial role in the recovery process. Now, education is power, folks. That's why many rehab centers offer educational programs as part of their treatment plans. These programs teach individuals about addiction, how it affects the brain and body, and the science behind it all. Knowledge is key to breaking down the stigma and shame associated with addiction. But it's not just about the science. These programs also equip individuals with practical tools and strategies for managing cravings, dealing with triggers, and preventing relapse once they leave the safety net of the rehab center. You know, recovery isn't just about addressing the addiction itself, it's about healing the whole person. That's where holistic treatments come in. These treatments complement traditional therapies and focus on the mind, body, and spirit connection. We're talking yoga, meditation, art therapy, music therapy, even things like equine therapy. These activities provide healthy outlets for stress relief, emotional expression, and self-discovery. It's about finding what works for each individual and giving them the tools to build a healthier, more fulfilling life. Now, many rehab centers incorporate 12-step programs like Alcoholics Anonymous or Narcotics Anonymous into their treatment plans. These programs have been around for decades and have helped countless individuals. These programs provide a structured framework for recovery, emphasizing accountability, support, and a sense of community. Participants follow a series of steps designed to help them confront their addiction, make amends, and build a new way of life. They offer a safe and supportive environment for individuals to connect with others who understand what they're going through. Sharing experiences and stories can be incredibly healing. Now, 12-step programs aren't for everyone, and that's okay. It's important to recognize that recovery is a personal journey. Some centers offer alternative recovery programs like SMART Recovery, which stands for Self-Management and Recovery Training. This program focuses on a more secular, science-based approach. It uses cognitive behavioral techniques to help individuals manage their thoughts and behaviors. The key is to find a program that resonates with the individual. Whether it's a 12-step program or an alternative like Smart Recovery, the most important thing is that it provides the support they need on their journey to sobriety. Everyone's path to recovery is unique, and finding the right fit can make all the difference. Let's talk about medication-assisted treatment, or MAT for short. This is a critical component of treatment for individuals recovering from opioid or alcohol addiction. MAT involves the use of medications like methadone, buprenorphine, or naltrexone, along with counseling and behavioral therapies. These medications help reduce cravings, manage withdrawal symptoms, and prevent relapse. It's important to understand that MAT is not a crutch, it's a tool, a part of a comprehensive treatment plan. It's about giving individuals the best possible chance at long-term recovery. Look, relapse is a reality of addiction, but it doesn't have to be the end of the story. That's why relapse prevention planning is such a crucial part of the rehab process. This is where individuals work with therapists to identify their triggers, develop coping mechanisms, and create a plan for dealing with cravings and high-risk situations. It's about empowering individuals with the tools and strategies they need to navigate the challenges of life outside of rehab and maintain their sobriety. Remember, recovery is a marathon, not a sprint, and setbacks are a part of the journey. Leaving rehab is a big step, and it's important that individuals have a solid support system in place. That's where aftercare and continuing support come in. Many rehab centers offer aftercare programs which can include things like sober living homes, outpatient counseling, and support groups. These programs provide a safety net, a bridge between the structured environment of rehab and the real world. They offer ongoing support, accountability, and a sense of community, which are crucial for maintaining sobriety in the long run. Now, we can't talk about addiction without addressing co-occurring mental health disorders. This is what we call a dual diagnosis, and it's more common than you might think. Many individuals struggling with addiction also have underlying mental health issues like depression, anxiety, or PTSD. That's why it's crucial that rehab centers offer dual diagnosis treatment, addressing both the addiction and the mental health disorder simultaneously. Ignoring one issue while treating the other is like putting a band-aid on a broken bone. It's not going to cut it. Addiction can take a toll on every aspect of a person's life, including their ability to function in everyday situations. That's why many rehab centers offer life skills training as part of their programs. These programs help individuals develop or relearn essential life skills that may have been neglected during active addiction. We're talking job readiness, financial management, communication skills, healthy relationship building, the list goes on. The goal is to empower individuals with the skills they need to rebuild their lives, achieve self-sufficiency, and thrive in recovery. Look, we've covered a lot of ground today, and I hope this has given you a better understanding of what drug rehabilitation centers are all about. Remember, addiction is not a sign of weakness, it's a disease. And like any disease, it's treatable. Seeking help is not a failure. It's the bravest thing you can do for yourself and your loved ones. Recovery is a journey, not a destination. There will be ups and downs, but with the right support and resources, lasting sobriety is possible.